PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. PSC സ്റ്റാഫ് നഴ്സ് പരീക്ഷാ പഠന സഹായി. PSC മുൻവർഷങ്ങളിൽ നടത്തിയിട്ടുള്ള പരീക്ഷകളിലെ ചോദ്യപേപ്പറും ഉത്തരങ്ങളും ഈ ചാനലിൽ ഇപ്പോൾ ഉൾക്കൊള്ളിച്ചിരിക്കുന്നു. ഈ വീഡിയോയിൽ 4/6/2014 നടന്ന ജൂനിയർ പബ്ലിക് ഹെൽത്ത് നഴ്സ് ഗ്രേഡ് 2 ഹെൽത്ത് മുനിസിപ്പൽ കോമൺ സർവീസിലേക്ക് നടന്ന പരീക്ഷയുടെ ക്വസ്റ്റ്യൻ പേപ്പറാണ് ഡിസ്കസ് ചെയ്യുന്നത്. ജനറൽ നോളജ് ഒഴിച്ചുള്ള ഭാഗങ്ങൾ ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും വീഡിയോ തീരുന്നവരെ കാണാൻ ശ്രമിക്കുകയും പഠിക്കാൻ ശ്രമിക്കുകയും ചെയ്യുക. നിങ്ങളുടെ ഫ്രണ്ട്സിന് ഇത് ഷെയർ ചെയ്ത് സഹായിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. 1 tablespoon is equal to -ml. 1 tablespoon is equal to -ml. Option A 20 ml. Option B 15 ml. Option C 10 ml. Option D 5 ml. 1 tablespoon is equal to 15 ml. 1 tablespoon is equal to 15 ml. In fowler's position, the patient is placed at an angle of options A 20 degree to 30 degree, option B 35 degree to 45 degree, option C 50 degree to 60 degree, option D 80 degree to 90 degree. In fowler's position, the patient is placed at an angle of 80 degree to 90 degree. In fowler's position, the patient is placed at an angle of 80 degree to 90 degree. The suffix itis means option A pain, option B vomiting, option C inflammation, option D swelling. The suffix itis means inflammation. Option C is right. The suffix itis means inflammation. The word cardiac is related to options A joint, B heart, C brain, D tongue. The word cardiac is related to heart. The word cardiac is related to heart. Bleeding from the nose is called Options: A. Epistasis, B. Epiphysis, C. Epispadiasis, D. Epicondyle. Bleeding from nose is called epistasis. Option A is right. Bleeding from the nose is called epistasis. Rice water stools is specific of option A. Dysentery, B. Rotavirus diarrhea, C. Cholera, D. Indigestion. Rice water stools is specific of cholera. Option C is right. Rice water stool is specific of cholera. 1 kilogram is equal to dash pounds. Options: A. 2, option B 2.2, option C 2.4, option D 2.6. 1 kilogram is equal to 2.2 pounds. 1 kilogram is equal to 2.2 pounds. Vitamin A deficiency can lead to options: A. Beriberi, option B. Rickets, option C. Night blindness, option D. pellagra. Vitamin A deficiency can lead to night blindness. Vitamin A deficiency can lead to night blindness. Which is not a good source of vitamin C? Which is not a good source of vitamin C? Options: A. Tomato, B. Orange, C. Lemon, and D. Nuts. Which is not a good source of vitamin C? Nuts. Option D is the right answer. Which is not a good source of vitamin C? Nuts. Which of the following prevent absorption of iron? Options: A. Tea, B. Amla, C. Guava, D. Beans. Which of the following prevent absorption of iron? Option A is right. That is tea. Which of the following prevent absorption of iron? Tea. Which is not a source of iodine? Which is not a source of iodine? Options: A. Cereals, B. Say sea fish, C. Cabbage. D. Sea salt. Which is not a source of iodine? Cabbage. Option C is right. Which is not a source of iodine? Cabbage. Weaning should be started by options A. 2 to 3 months. Option B. 5 to 6 months. Option C. 10 to 12 months. Option D. After 12 months. Weaning should be started by 5 to 6 months. Weaning should be started by 5 to 6 months. Oral thrush is caused by options A. Candida albicans. Option B. Campylobacter jejuni. Option C. Clostridium tetani. Option D. Klebsiella. Oral thrush is caused by Candida albicans. Oral thrush is caused by Candida albicans. Chromosomal abnormality in Down syndrome. Options A. Trisomy 13. Option B. Trisomy 18. Option C. Trisomy 21. Option D. 44x0. Chromosomal abnormality in Down syndrome. Trisomy 21. Chromosomal abnormality in Down syndrome. Trisomy 21. Chromosomal abnormality in Down syndrome is trisomy 21. How many cranial nerves originate within the brain? Option 8. Option B 10. Option C 14. Option D 12. How many cranial nerves originate within the brain? 12. How many cranial nerves originate within the brain? 12. Which one of the following is not a method of composting? Options A. Aerobic. Option B. Anaerobic. Option C. Mechanical. Option D. Controlled tipping. Which one of the following is not a method of composting? Controlled tipping. Which one of the following is not a method of composting? Controlled tipping. Which one is not a physical method of sterilization? Options A. boiling. Option B, Lysol. Option C, autoclaving. Option D, radiation. Which one is not a physical method of sterilization? Lysol. Which one is not a physical method of sterilization? Lysol. A drug that is given sublingually for heart attack. Option A, nitrofurantoin. Option B, nitroglycerine. Option C, prusside. Option D, digoxin. A drug that is given sublingually for heart attack. Nitroglycerine. A drug that is given sublingually for heart attack. Nitroglycerine. Drug used against worms. Options A, mebendazole. Option B, primaquine. Option C, Lasix. Option D, clomiphene. Drugs used against worms. Mebendazole. Drugs used against worms. Mebendazole. Drugs that relieve pain are called. Options A, antipyretics. B, analgesics. C, antiemetics. D, antitussives. Drugs that relieve pain are called analgesics. Drugs that relieve pain are called an instrument used to measure blood pressure is called. Options A, thermometer. B, fetoscope. C, fibro-optic endoscope. D, sphygmomanometer. Instrument used to measure blood pressure is called sphygmomanometer. Instrument used to measure blood pressure is called sphygmomanometer. Inflammation of stomach is called. Options A, glossitis. B, stomatitis. C, gastritis. D, enteritis. Inflammation of stomach is called gastritis. Option C is right. Inflammation of stomach is called gastritis. Which vitamin is preserved during parboiling of rice? Which vitamin is preserved during parboiling of rice? Options A, vitamin B1. Option B, vitamin D. Option C, vitamin A. Option D, vitamin K2. Which vitamin is preserved during parboiling of rice? Option A is right. That is vitamin B1. Which vitamin is preserved during parboiling of rice? Vitamin B1. Gout is the hereditary disease resulting from the defective metabolism of option A pyruvic acid, option B carbonic acid, option C nitric acid, option C uric acid. Gout is the hereditary disease resulting from the defective metabolism of uric acid. Gout is the hereditary disease resulting from the defective metabolism of uric acid. Child helpline number. Options A 1890, option B 1809, option C 1098, option D 1908. Child helpline number is 1098. Child helpline number is 1098. Strength of normal saline is options A 0.5 percentage, option B 0.9 percentage, option C 0.7 percentage, option D 101 percentage. Strength of normal saline is 0.9%. Strength of normal saline is 0.9%. Normal blood pressure is options A 130 by 80 mmHg, option B 120 by 90 mmHg, option C 120 by 80 mmHg, option D 110 by 90 mmHg. Normal blood pressure is 120 80 mm by 80 mmHg. Normal blood pressure is 120 by 80 mmHg. The word osteo is related to option A check, option B bladder, option C blood, option D bone. The word osteo is related to bone. The word osteo is related to bone. The stoppage of breathing is called options A apnea, B gangrene, C anorexia, D asepsis. The stoppage of breathing is called apnea. The stoppage of breathing is called apnea. Stool of newborns is called Option A, meconium. Option B, colostrum. Option C, recurrent jelly stools. Option D, transitional stools. Stools of newborns is called meconium. Stools of newborn is called meconium. Antitussives are given for option A, decreasing gastric acids. Option B, relieving temperature. Option C, clotting of blood. Option C, decreasing cough. Antitussive are given for decreasing cough. Antitussive is giving for decreasing cough. Which of the following signs suggest that the circulation to the distal extremity is affected after a bandage is applied to an extremity? Which of the following signs suggest the circulation to the distal extremity is affected after a bandage is applied to an extremity? Options A, warm hands and or legs. Option B, pink skin of the hands and legs. Pink skin of the hands or legs. Option C, full range of motion of extremities. Option D, swollen or congested limb. Which of the following signs suggest the circulation to the distal extremity is affected after a bandage is applied to an extremity? The right answer is option D, swollen and congested limb. Which of the following signs suggested that the circulation to the distal extremity is affected after a bandage is applied to an extremity? Swollen and congested limb. Hemoglobin estimation can be done by options A, Snellen's chart. Option B, Sahli's chart method. Option C, rota test. Option D, nitric acid test. Hemoglobin estimation can be done by Sahli's method. Hemoglobin estimation can be done by Sahli's method. Shaki's tape is used to measure options A, height. B, mid-arm circumference. C, head circumference. D, weight. Shaki's tape is used to measure mid-arm circumference. Option B is the right answer. Shaki's tape is used to measure mid-arm circumference. Shaki's tape is used to measure mid-arm circumference. In the hot test urine of sugar, the yellowish color change represents options A, 0.5%, option B, 0%, option C, 1.5%, option D, 1%. In the hot test for urine sugar, the yellowish color change represents 1.5%. In the hot test for urine sugar, the yellowish color change represents 1.5%. In the hot test for urine sugar, the yellowish color change represents 1.5%.
Thanks for watching. PSC Nursingന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC Nurse എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.